No.
All right, I'll bring the phones back in here. We'll hang it up. Is that comfortable distance for you?
Yeah. Oh, yeah.
All right. Cool.
Thanks, Sam. Way to go, man.
Of course.
There is one more headset. Well, this wouldn't.
Is the stream not on? Check it out.
Yeah.
Not hearing.
You're not hearing it there? Oh. That's fine. No, leave that. It's just not plugged in.
Yeah, it's not plugged in. Okay. Hello and welcome to Dateline New Haven. I'm your host, Paul Bass, inviting you to look behind the headlines on the stories that make New Haven tick. Medicaid, the government program that pays for health care for the poor, is under attack. 5 people who are fighting back have come squeezed into the WNHH studio to tell us why that matters and what might happen next. Say hello to New Haven Legal Assistance Association attorney Sheldon Talman. That's a long way of saying legal aid lawyer. Thanks for coming in.
Nice to be here.
Say hello to Bonnie Muller of the Friends Center for Children. Hi, Bonnie.
Glad to be here too.
Christine Garassi, did I say it right?
Jurassic.
Garassi, okay. And whose daughter has a rare genetic disorder.
Yes.
We're going to hear about that. Cheryl McNamee of the Clifford Beers Clinic. And hello, good morning. And Derek Thomas of Connecticut Voices for Children. Thanks, everybody, for coming in, and welcome to the studio. So we're here for 2 reasons. One is that the federal government wants to slash by tens of millions of people who now get it, Medicaid, under the versions of Senate and House Republican bills to undo Obamacare. But at the very same time, you're facing in the state proposed cutbacks in Medicaid as well. So you're here because you group of people in this studio are involved both at the state level and the federal level trying to save Medicaid. So maybe we could start with the federal bill. Someone want to jump on and tell me what's at stake with the Senate Republican bill that's now been put on hold until after the July 4th recess for Medicaid.
I'd be happy to
You can
address that.
bring the mic real close to you.
So the bill in the Senate is not significantly different from the bill that was passed by the House.
I think one said that 22 million people will lose health insurance and one said 23 million.
Yeah, that sounds right. The bill that's before the Senate now would cut off 22 million people by 2026, but 15 million of them would be on Medicaid.
Mm-hmm.
And moreover, that's by 2026, but the Congressional Budget Office, that's what we're talking about here, the nonpartisan analysis, finds that 15 million also will be cut off by next year. So please get real close to the mic, Sheldon, like almost touching it. So they're saying that by next year, 15 million Americans who have insurance now will not have it. And they're saying by 2026, when 22 million will be cut off, 15 million of those will be on Medicaid. That's correct.
Now, how much of a chance does this have of passing?
Well, we're all reading carefully every article we can find about it, and the worry is that some of the Republican senators who have expressed concern about the bill, and in 2 cases said they will not support it because it cuts too deeply on Medicaid, among other reasons. Potentially, the leadership could be encouraging them to accept some minor changes and then say, okay, well, it's okay for my state, so they'll go along with it. So that's what we expect is happening right now, serious horse trading with recalcitrant Republicans. And then there's the other group of Republican senators, the more conservative ones, led by Ted Cruz and Rand Paul. They find the bill does not cut deep enough. So Mitch McConnell has a very hard time sort of satisfying both
Senate Majority Leader.
Senate Majority Leader, correct. Has a really hard time trying to satisfy both sides. But this did happen in the House. So that's why we're very concerned it could happen in the Senate.
Okay, and the Congressional Budget Office, the nonpartisan group, as you said, it said it would decrease Medicaid spending by $772 billion over a decade. Now, Republican supporters of this general approach, they responded this week and said it really doesn't cut Medicaid. They said what happened is that when Obamacare, the Affordable Care Act, was passed, it greatly expanded Medicaid. A lot more people who didn't used to get Medicaid get it now, right? Isn't like a quarter of the country or something get Medicaid? That sound right?
Well, in Connecticut, as one example, we have about 750,000 people on Medicaid statewide, and about 217,000 are on our Medicaid expansion called Husky D. So you can do the math; it's a little less than a third.
Okay, and Malloy, the governor, has said that tens of thousands of them would lose their Medicaid under this federal bill. But what the Republicans argue is that you're not cutting Medicaid spending. They're saying that if this Obamacare bill increased Medicaid so that new people get it, all they're doing is slowing the increase in Medicaid spending rather than cutting Medicaid spending. But then why, if that's true, why would 15 million fewer people have Medicaid after this bill if the total amount isn't being cut?
Right.
Is that because the cost goes up for every year for medical care?
That's a big part of it. Basically, the claim is disingenuous. What we have is a situation where, as the Congressional Budget Office said, $772 billion less will be available cumulatively by 2026 under this bill than under the status quo with Obamacare. And although you may not actually reduce the total dollars going out, over time with inflation, and inflation in medical care is higher than regular inflation, over time, if you are capping how much each state can get, so they're not keeping up with inflation, then there's going to ultimately have to be significant cuts. And what the figure is, according to the CBO, is a 26% cut in all the money coming.
So we're not talking about consumer price index inflation, because if I'm not mistaken, that's like 1 or 2% a year. We're talking about the inflation in medical care, what it costs to get health care, which is much bigger every year.
Correct. Now, there is an allowance for that in terms of the medical cost of living adjustment, but under the Senate bill, after 2025, that goes away, so now it's just at the basic cost of living.
But they're saying even the first year, all these people would lose this, so that inflation would more than make up the decrease in the increase that even in that first year, 15 million, including many on Medicaid, would lose their health insurance.
Well, the reason why a significant number of people lose Medicaid on the expansion is under Medicaid, under this bill, is that states will either not do the expansion who would otherwise do it, because there's several states out there that are in the process of deciding what to do, but also some will bail. So basically, because of what's going to happen in a few short years, where the amount of money for reimbursement for the expansion starts going down lower and lower, some states will just get out of it, and of course the remaining states who have been on the fence aren't going to do it. So they're comparing to that.
We're talking about Medicaid here with 5 folks who are trying to save it in the face of efforts to dismantle it or greatly reduce it at both the federal and state levels here on Dateline New Haven and WNHH, your home for community radio, 103.5 FM, live streamed at newhaveninfant.org. Let's just step back and talk about Medicaid is, because when you look at the history of Medicaid, there's a real disconnect in its history and who gets it and who's fighting to cut it. And this is the part that confuses me the most politically. So Medicaid was started in 1965 as part of an act that actually created Medicare for the elderly. And nobody kind of noticed or paid much attention. It also created this program, Medicaid, for lower income people, which grew over the years. And states administer it, and the federal government pays much of the freight. Is that a fair way to describe what Medicaid is? You're shaking your head yes, Cheryl?
Yeah, that is my understanding, and it is administered by the states, and they have their own state plans and state ways of implementing Medicaid.
But does the federal government pay about 50%, a little more?
It varies by state, but in Connecticut, we get mostly for most of the Medicaid program 50 cents on the dollar, except for the expansion, for which we get 95 cents.
And again, that's what Obamacare did. One big part of Obamacare is it enabled states to put more people on Medicaid who couldn't afford health insurance. And this is the part that confuses me. Donald Trump voters were the ones who, way more than everybody else, benefited from that. So Kentucky, I believe that 1/3 of the people in Kentucky now get Medicaid. That's how they can afford to get sick. And their senators are, Rand Paul and Mitch McConnell, are 2 of the leaders to dismantle Medicaid. And the governors who chose to say no to getting that extra help from the federal government on Obamacare to expand Medicaid all came from these states where more people need it. And these are the people, but then the voters genuinely say, we don't like Obamacare. We don't like this law. Get rid of it. And this is the law that's putting tens of millions of them under coverage so they can afford to get sick. Cheryl, any thoughts? What am I missing?
I think you're saying it rather accurately, and a really interesting piece of Kentucky that you mentioned is Eastern Kentucky is particularly rural and really was suffering economically greatly. And because of the Medicaid expansion, the healthcare industry rooted itself quite a bit deeply into Eastern Kentucky. And with the rollback on Medicaid under the Senate bill, that's all going to go away. That's
another reason we all who in blue states say this is crazy, say you're also getting rid of jobs. But how about if we don't? We have a tendency, right, in our bubble to say, well, these people are dumb. They don't know their own interest, right? They're voting against their own interest. Sheldon doesn't say that. But a lot of people like me step back and say, this doesn't make sense. They got the help. They need it. And they're against it. They say they're against Obamacare. I actually don't believe they're dumb. I believe there's got to be a reason that people are saying, I hate this thing that I support. Like I believe in Kentucky, if I'm not mistaken, someone from Kentucky has told me that the most popular social program in the history of Kentucky is what Obamacare is called there. And yet their senators who need those votes to stay alive are leading the charge to get rid of it. So there's got to be something we're missing. Any thoughts of anybody about what could be leading the dominant political force in this country to be doing that? We're just shaking our heads. We're just going to have different guests for that. We need to focus in.
I think it's a lot of speculation. I think, we have 6 people in this room, and we could probably answer that 6 different ways as to why that is so inconsistent. I honestly think it'll be history that's going to answer that question. I'm baffled.
We tend to see people that we don't agree with as manipulatable. So we say there was a great Koch brothers campaign to just say we hate Obamacare, but not tell you what it is you're really hating, that it's healthcare for you. That you just hate big government, except when it helps you. And that was just a very sophisticated public relations effort to just make sure Obama didn't succeed and that big corporations would be off the hook. Because what the federal bill really is a transfer of wealth to people who have a lot of money and pay taxes, and it just cuts their taxes. I believe we're wrong. I believe there's something a little deeper for that to work. Because we've seen big money in politics fail to just turn people into robots, right? We had 2 Senate races here in the last 2 cycles where a woman spent $50 million to become senator to destroy the reputation based on lies of people she was running against. And she didn't win. I mean, there's a point at which big money just doesn't convince people to do things that they think are against their interest. Any thoughts?
Well, I think what you described a little bit ago is partially right. I think that if there's been a concerted effort to persuade people that the problems in their lives are related to government, that government is the cause of the problem.
And that we're not government.
Who's not government?
That's what I mean. Like government isn't we the people, government is them.
Right. That message resonates with a lot of folks, and it's easy with a lot of media on this and with everybody around you saying the same thing to accept that philosophy, and then there's a disconnect between their personal situation.
And also their premiums did go in. Like people like me would argue that Obamacare, because of compromises to get it passed, actually showed some of the seats of its ineffectiveness by not going to a single payer system, by still allowing insurance companies to make a lot of money by denying you coverage and building in costs that they can make their profits from that make healthcare more expensive. So we could argue that people have legitimate reasons to look and say years later, I'm still paying more premiums. I'm still fighting with insurance companies who won't reimburse me. Why is this better?
Right, but I think it's important to recognize that the Senate bill is a really big bait and switch in the sense that there are problems with Obamacare, just as you said, with premiums going up way too high and people having trouble affording it and deductibles they can't afford. But you have to understand that most of what this bill does is destroy the Medicaid Act, which existed prior to the passage of Obamacare, in order to do big tax cuts.
Mm-hmm. Christine Gerasi, you're a parent whose daughter has a rare genetic disorder that causes developmental and intellectual disabilities. Is she on Medicaid?
Yes, my daughter receives supplemental Medicaid through the Katie Beckett waiver.
What's the Katie Beckett waiver?
So the Katie Beckett waiver is a waiver that every state has, and basically what it does is it qualifies you for Medicaid by only looking at the applicant's income. So they would only look at my 4-year-old daughter's income, which you would imagine is quite small. So She gets Medicaid through the pediatric waiver.
And is that endangered now by the federal bill?
Well, I think not only is that endangered, but I think what's really impacting parents of disabled children is also the schools. I think that what a lot of people don't know is that Medicaid helps supplement the lack of special education funding in our districts. So you can bill for speech therapy, physical therapy, occupational therapy. You know, Mackenzie gets 7 therapy appointments in her school, you know, weekly. So if that's at jeopardy, we're also, you know, looking at our education being jeopardized by this bill.
What will happen to your life if that changes?
Well, you know, we went, when we got Medicaid, you know, we were, so for example, Mackenzie was in the hospital the past 2 days. She was at Yale, you know, doing a very intensive neurological study. And if I didn't have Medicaid, I would have been walking out of there, you know, with a $5,000-$6,000 bill. So that,
And not
that's
just once a
happened.
year.
Yeah.
So
Well,
what happens if you can't afford it?
Exactly. So then, you know, yesterday we found out, you know, this could be impacting, you know, Mackenzie's development. And if I can't keep up with these studies and her medication, you know, Mackenzie, you know, will suffer. Her health and her well-being will suffer.
So what have you done as a mom? When did you get involved in this issue, and how are you getting involved?
Well, I got involved in this issue on Friday with my good friend Cheryl over here. I went and testified with Blumenthal and Murphy. And
Oh, we had you in our article right in the New Haven
Yes,
Independent,
you
right? Like
did.
you had a
Yes.
hearing at the Hall of Records
Yes.
where people who were affected by potential cuts
Mm-hmm.
of Medicaid came and spoke with the two Connecticut U.S. senators who are ready
Yes.
for preserving it, but
Mhm.
wanted your stories to be told
Yeah.
at a public event.
Yeah, and you know, I'm delighted to say I guess my statement really had an impact on Senator Blumenthal, and he went to the Senate floor with a big, huge photo of Mackenzie in the background on Monday night and had told her story a little bit and how this impacts, you know, parents of disabled children in Connecticut.
Did you watch that
I did.
on
Yeah.
what channel? C-SPAN?
C-SPAN.
What was it like to see that?
It was pretty amazing.
Did it kind of feel like, with all the pressures you face as a parent with a kid with that kind of disorder, did it feel validating? Did it feel...
It did. It kind of felt like, you know, I think what people sometimes think is like, oh, when I pick up the call my local office, you know, my voice isn't going to be heard. It's just, you know, it's just a phone call. It's not going to make a difference. But, you know, here was someone who heard me speak for 4 minutes and then, you know, took it to the Senate floor. So that was, you know, pretty amazing that, you know, just one voice can really have an impact.
All right, and you're having an impact on Dateline New Haven here. I'm your host, Paul Bass, with 5 folks who are fighting hard to preserve Medicare from cuts in Senate and state bills. We got to get the state bill, too, before the legislature. We're at WNHH Radio 103.5 FM. So Harry Drost is our station manager. He's also the bravest man in New Haven. He's a proud Donald Trump supporter, and he hates Obamacare with every fiber in his body. He's not a rich guy. He's not a white guy. He's voted for many Democrats. Harry, the question we were starting with here is people who are all like-minded, is why would so many people who have benefited from the expansion of Medicaid, like in Kentucky, 1/3 of the people are on Medicaid. It's a very popular program under a different name from Obamacare. Why do so many Donald Trump voters, who are the ones who are benefiting most from the expansion of Medicaid, support getting rid of it and Obamacare? What is the reason? Because we all, people like me, say, well, they're dumb. They don't know their own interest. They're being fooled by the Koch brothers and saying to hate government without realizing it's something that's helping them stay alive.
Nice putting me on the spot, Paul. But see, my thing is Obamacare was broken to begin with. They knew that the money would run out, which is why he started it a couple of years late, so he wouldn't have to be in office when actually Obamacare crashed and burned. But my thing is that every state, and I actually like this part of the proposal by the Republicans. I know people are going to look at me weird, but the fact that the governors get to decide on their Medicaid and actually have control over how to run the programs, I think would be excellent. And governors need to be innovators and actually use that money properly.
Now, we've seen in states like Nevada where the governors are actually, who are Republicans, are saying don't cut it.
Yeah, because they don't want to be responsible. They want to put all the responsibility on the federal government. Now, the federal government is not supposed to be so intrusive as it is now. So the states should have more power when it comes to Medicaid and stuff. So you block grant it so that these governors could actually do their jobs and be innovators within their own state.
Now, the reason they don't like that is because when you block grant it, they're also going to give them a lot less money. So it becomes a way that they won't be able to have as many people covered.
Now, I was looking at the budget, and what they're not actually taking away money from Medicare. They're actually cutting the growth.
Right, we talked about that.
Right? So it's different when you're saying, and people out there hear it differently. When you say they're cutting Medicaid or Medicare or anything like that, when they're actually cutting the growth of it. But also, they're cutting the growth anticipating that the governors would come up with innovative ways of actually how to cut the cost here in the states. And it should, governors should do their jobs.
So now, as Sheldon Talman pointed out, they're cutting the rate of increase below the rate of medical inflation. So that's why it's a real cut, and that's why the Congressional Budget Office says 15 million people would lose it. But does it sound like your argument is that if governors have the pressure with fewer dollars but more flexibility on how to spend it, they'll come up with ways to cut healthcare costs so that people don't lose it? Is that where you're coming from?
Yes, but also remember the CBO is working on the numbers of the inflation that's going up right now. The cost of inflation is going up drastically, right? If we actually are able to control that cost, then that inflation won't exist. We actually have to bring the cost down.
So anyone in the room want to grab that? So Harry's saying that if you let governors have the freedom of how to spend it, but have the pressure as labs of innovation in their states to cut the cost, we're actually going to be able to live within those means. And Sheldon, real close.
Sure, I'm happy to address that. Thank you, Harry. That was an interesting perspective.
Yeah, we're not beating up on you, Harry.
No.
You're just going to represent 95% of America for us while we're in our
The Medicaid program is a combined state and federal program, right? There's federal rules, there's state rules, there's federal money, there's state money. The Medicaid program already gives tremendous flexibility to all the states, and there's a waiver process on top of that whereby the states can get changes. I think the best way to talk about why Medicaid is a success and already has all the innovation flexibilities that it needs is to look at Connecticut. Connecticut is a national leader. I don't know if folks saw the article in the Wall Street Journal last year focusing on the success in Medicaid. We are very innovative. And how are we innovative? That most states use insurance companies, capitated insurance companies that get paid a fixed amount of money per member per month. And for years, we ran our program that way. And it was very inefficient. And what we did under the leadership of Governor Malloy, at the
behest of Sheldon Talman, if I'm not mistaken,
and Ellen Andrews from the Connecticut Health Policy Project and many other advocates, what the governor did is to say, you know what, we can do it better and cheaper without having insurance companies taking a big hunk off the top and then, of course, denying care in order to make more profit. Instead, we can take the risk back in the state and move to something called patient-centered medical homes, where the primary care provider is responsible for coordinating all the care and is paid a little extra. And under our innovative program, we also pay providers extra if they do well on certain quality measures. Under that innovation, Connecticut has saved a lot of money. In fact, over a 4-year period after this was done, we on average per person reduced per member per month cost.
So you're saying that can happen without, and Cheryl, you seem like you want to jump in here. What were you going to say?
Yeah, I do. Yes, and yes. And I'm here on behalf of Clifford Beers Clinic. And for your listeners who don't know, we are a behavioral health care agency. Been in the community for 104 years, largely actually credited with kind of coming up with outpatient mental health care through Clifford Whittingham Beers. And we just, we're wrapping up a CMS grant, a $10 million grant over 3+ years that did precisely what you described, Sheldon. And yes, cost savings, but let me add, importantly, better outcomes. You know, we're getting healthier people. We're seeing depression rates go down. We're helping to look at the social determinants of health and stabilize things like housing. We're looking at children who are using the emergency room for primary care for things like asthma and getting there sooner and faster and doing preventative early intervention type of care. And thereby not just lowering costs, as you indicated, but getting healthy people. We are a healthier greater New Haven because of what Clifford Beers has done over the last 3 years.
So Harry, I'm guessing you would agree that those kind of things are good. Are you persuading me, listen to them, that there's not a need to block grant it to give governors that freedom if they already have that freedom? Do you feel like it puts more pressure on them because there'll be less money?
There won't be less money. The growth will be less. Now, I'm all for, people innovating. That it's just the government that has to draw back and find ways to make things cheaper. I mean, right now, you look all over the state of Connecticut, the health departments are being gutted. And that's not because they're doing great. They're doing poorly with the money. New Haven right now is gutting most of its health department. And that's mothers and, women and children who are suffering now that don't have services.
All right, can I jump in on that? The reason they're doing that, Harry, is that state aid has been cut because Republicans have more say at the Capitol now, and there's no political possibility of raising revenue to cover that aid to the cities.
I don't want to get into a tax debate here,
Okay.
but the reason you're doing that is because less money's coming in tax-wise, right? That's the thing. The tax the rich thing is really never going to work. The rich could take their money elsewhere. Okay, so we have to figure out ways to do it within the system, not count on rich people's money.
So tax me. Tax me when I go on the highway so that when I'm paying a toll to New York, I'm also paying it to New Haven 95.
Okay with that.
Tax me when a friend of mine might want to buy like a bag of pot for a gift for a 60th birthday party or something. Would that be okay?
That would be okay with me. I also say tax you when you're riding your bike on the road.
Okay, that's a different degree. And that's the kind of degree argument we have on Dateline New Haven here on WNHH Radio, your home for community radio, 103.5 FM, live stream at newhavenindependent.org. Harry Droves, you are the bravest man at New Haven, and thank you for illuminating us on what most of the real world thinks. And we are talking here about how to save Medicaid in the face of threats to its funding at the state and federal levels. So we just talked a lot about the great work that has gone on in Connecticut to make Medicaid work, to make our version of Obamacare work. In fact, a couple of people in our studio, including Sheldon Talman of New Haven Legal Aid and Cheryl McNamee of Clifford Beers, have been involved in that process where we've learned that we can cover a lot more people the same amount of money and do it better if we change from some of the old systems we had with greedy, inefficient insurance companies with business models based on denying you the care they've already promised to give you. But why is it then, I'm going to ask Derek, we're caught this from the Voices for Children, why then are we fighting right now in Hartford? If we've done such a great job with healthcare, what is the fight that's going on this very day up at the state capitol, Derek? And if you can get the mic real close to you, can you fill us in on what that fight is all about?
Yeah, so my name is Derek Thomas. I'm a fiscal policy fellow.
I gave you the name of the Pulitzer Prize
winner. Fiscal policy fellow for Connecticut Voices.
And I need you real close to the mic.
Fiscal policy fellow for Connecticut Voices for Children. We're a statewide research and advocacy group that's committed to equitable opportunities for all children across the state. And what we're doing right now is joining advocates in a call for a more balanced approach to the state budget. As your listeners probably know, over the next biennium, we have little more than a $5 billion budget hole. So what we're talking about when we say a balanced approach is one that doesn't exclusively rely on cuts alone, such as the budget last year that filled a nearly $1 billion budget hole with cuts alone. That resulted in less healthcare, less education, and other investments that have contributed to the state's high quality of life. So we're asking lawmakers to take a hard look at the revenue side of the budget, not just spending cuts. And I just want to address the comment about wealth fleeing the state. There's been this pervasive myth in the state that millionaires are fleeing, and some suggest that the reason that that's happening is because of tax rates. Well, there's a lot of research that suggests that that's just simply not the case across the country. And when we look at IRS data, we find that it's not just, it's actually low to middle income folks that are leaving the state, that are filing less returns. In fact, we've seen growth upwards of 20 to 30% for income earners above 100,000, above 500,000.
Well, we are told, at least by the governor's people, that in 1 year, if one hedge fund or 3 hedge fund people in Fairfield County happen every year, they're reporting tens of millions of dollars less in profits, that in fact that can throw our budget out of whack, and that part of the reason we've had these unpredictable projections on revenues is because we're relying so heavily on these big earners who find other ways to hide their money.
It's true that, I mean, we acknowledge the fact that if one billionaire leaves the state, then that does impact state revenue.
But then the other argument I've heard, and tell me if I have these numbers right, because I don't think I have them quite right. If you earn over $1 million, that income over $1 million is taxed at something like 6.38% in the state. But that if you just went to the next state, New York or Massachusetts, you'd be paying 6.99 or something percent on that, correct?
Oh, I believe it's a little bit more.
Or 7. So in other words, one argument that's made that in fact, if rather worry about driving people out, those states not driving people out, that in fact we can raise, there is still more money there, that we can raise more money even from the wealthiest people by matching what other states around us do, whether it's tolls on the highway or income. And also when the hedge fund people do report their earnings, they're paying only 15% rather than that 33% really, because they're under a tax loophole for capital gains. They're allowed to describe it differently. So is this the kind of change you guys are looking for so we don't have to have cuts in Medicaid? And why are Democrats not supporting that? Why is Martin Looney saying that's not the answer?
So we are looking, so you're correct that we actually, Connecticut has room to grow the to raise in tax rates on the top income earners. In fact, we could raise rates on the top 2 income groups by a half percentage point and raise $250 million, which would avoid some of the cuts to healthcare and education that folks are talking about today. And the state would still be competitive with New York and New Jersey.
So what is it that's going to be cut? What do you fear in dollars and cents is going to happen today in the special session legislature or over the next few weeks while they try to cobble together a 2-year budget that gets rid of a $5.1 billion budget deficit? What is on the table about Medicaid? Anyone want to jump in here?
I can just quickly list some of the serious cuts to Medicaid, which are in basically all of the budgets, between the governor's budget, the proposed budget, the Republican senators, the Republican House, and Democrats. All of those budgets provide for cutting off 9,500 people from Medicaid July 1st, and it would have been July 1st. These are people who are very low income. They're between 138% and 155% of the federal poverty level.
And what is that?
I'll look for that figure. I don't have it on me right at the moment, but it's a low.
So even in blue Connecticut, where you and Cheryl just got done talking about what a great job you with Medicaid, people on all sides, including Democrats, are talking about throwing 9,500 poor people off of Medicaid?
Right, and here's the figure. So 138% of poverty for a family of 2 is 22,107. 155%, that's the maximum this group being cut off. Family of 2 is 24,831. Yes, they would cut them off with Medicaid. So that's one of the cuts.
Wow.
Another cut is to 39,000 people. At least all the budgets provide for 39,000 people being cut off, and the governor's revised budget called for more from something called the Medicare Savings Programs, and these are programs.
Medicare
Savings Programs. It's a Medicaid program that fills in basically the high cost sharing under Medicare. Middle class people can afford the cost sharing under Medicare. Low income people cannot. And this program covers that. So 39,000 people would be cut off of that program.
So that's a program that helps people on Medicare, but it's a Medicaid program, be able to afford Medicare.
Basically, right. And so if they can't afford the 20% copay for going to the doctor, they're not going to go to the doctor. So that's the second one. The third cut is the dental benefit. There'd be a cap of $1,000 a year, although you can theoretically request prior authorization for more, but it's going to be, as a practical matter, difficult to get more than $1,000 a year of that. There's something called the Community First Choice Program, which is a critical program under the Obamacare, in fact. It's an option under Medicaid to provide, pay for personal care assistance for people so they don't have to go into nursing homes. So these are some really basic cuts that are in.
And how many people are affected by that?
Several thousand. I don't have the exact number on that.
All right, let me ask Bonnie Muller. So you work at the Friends Center for Children. You've been in this this fight too. You work with the Emotional Well-Being Coordinator. That's a great title. You think of all the cold bureaucratic titles people have. That's a pretty nice thing to be if you got to have a long title. Emotional Well-Being Coordinator. What does that mean, and how does what Sheldon just described, with 39,000 people getting caught from a program that lets them afford Medicare, another 9,500 people, even Democrats, want to cut from basic Medicaid, poor people, thousands more with dental benefits. How does that affect the work you're doing with the French Center for Children?
At our center, which is intentionally socioeconomically diverse, there are about 23 out of 44 families that would lose the adults' health care.
I'm sorry, what is the center exactly?
The French Center for Children is a nonprofit early childhood education center. We serve children from 3 months to 5 years of age, and we have families from all over the New Haven area, and we have intentional socioeconomic diversity, which requires considerable augmentation of what families can pay in order to provide families with equal access to high quality early childhood care.
So now, how have you got involved in the Medicaid issue and why?
I have become involved because, as Sheldon mentioned, all of those programs, I know the parents and the grandparents and the young people who are using those programs, who are able to maintain employment because of those programs, who are able to, as Cheryl mentioned, the depression in our community of young parents is very high, and being able to get behavioral health services through places like Clifford Beers Clinic and private practitioners. These are all ways that parents are able to keep their children doing what they need to do, going to school and being healthy. The school-based health programs that would be cut, their children who rely on that solely to be able, because their parents are incapacitated in various ways emotionally, they go to the health clinic in school and they get diagnosed early with strep throat, and they therefore get treatment quickly. These are kind of ways that I see people benefiting so much from the services that are available. In-home health services for parents who are having trouble controlling their very confused.
And some of these are the very
people.
families who will lose Medicaid, even in Connecticut,
yes.
under this bill. So what have you done about it? Have you gone to speak at hearings? Do you go to strategy sessions? Do you contact legislators? What is your role?
Write the governor, contact legislators. I just purchased Rosa DeLaura's wonderful new book, The Least Among Us, where she lays out a wonderful analysis of why it makes so much sense to keep programs for people who are in some way disabled or unable to fulfill their potential, and keep programs like this going.
Sheldon?
Well, I think in looking at the big picture here, it's important to recognize the balance, right, between government spending and concerns about taxes and basic needs and whether healthcare is right and all that. The governor has actually been very strong. Governor Malloy has been very strong along with our senators, in calling out the Senate bill and the House bill in Congress. I mean, here's what he said about the House bill. It's tax relief for the wealthy. Yeah. And in a press release he issued just 2 days ago, referring to the Senate bill, he said if the purpose of the Republican bill was to raise health care costs for all consumers and offer significant tax cuts to the wealthiest Americans while denying care to women, the oldest, the youngest, and poorest citizens, the bill does a good job. I think that's right. Actually, I'm sorry, that's Lieutenant Governor Wyman is attributed to that, but in his press release. And I think that they have it right there. But the problem is that on the state level, we've got something else going on similarly.
Well, that's what I wanted to ask you, or Derek, if you want to jump in here. It's easy in a blue state, even though it's not so blue when you run for governor, and it's getting a little more purple, but especially in our federal guys, it's easy to attack the Republican bill among our voters in Washington. But we got some pretty tough choices in Connecticut. So does that, when Sheldon reads you those quotes, Derek, or anyone else here, are you persuaded when you see the decisions they're proposing?
Well, I think it's fair to point out that, that's great criticism of the healthcare bill coming out of Congress, but here in the state, your listeners should know that all budget proposals from the governor, the Democrats, and the Republicans, are making cuts to these programs, these important programs, Plus, they're raising taxes on low to middle income families by cutting the earned income tax credit and the property tax credit, while at the same time making changes to the estate tax, which would, on average, provide a $100,000 tax break to some 600 of the state's residents. So I think that's fair to point out. And I just want to make another point that in addition, to these other, to the cuts to healthcare, these cuts have a compounding effect. So we've looked at, say, a single mother who makes $30,000 has, she would, under these proposals, under the governor's original proposal, would no longer be able to enroll her child in Care for Kids, would lose her Husky coverage, and would see a $93 tax increase due to the cuts to the earned income tax credit and the property tax credit.
All right, maybe Shirley, look, you want to jump in here. So tell me about a real person as well. Give me a first name without identity. How someone's life will change.
Well,
You work with the Clifford Beers, because you work with families in distress all the time, Clifford Beers Clinic in New Haven. If Medicaid is cut, tell me about one family whose life will be different and how.
There are a lot of ways to answer that. I think the first thing I would want to say is perhaps go a little more globally and talk about the state budget, which looks like it's going to be operated by executive order, at least in the short term, with July 1st moments away. I rely on my CFO, Mike Riso, for this information, and his analysis of the executive order budget that's going to be coming from Malloy short changes us about $500,000.
You, Clifford Beers alone.
Clifford Bears Clinic.
Oh my gosh! So
$500,000.
How much is your total budget?
About $16 million for projected 2018.
So 1/32. That's 3% of your budget.
It's 3% of your budget, but going back to what you said, talk about a family. That's a real human being.
That's a lot.
That's a lot of human beings.
So tell me about a human being who will be affected by this cut and how their life will be affected.
Well, going back to what I said about being innovative and the need for care, and I think Bonnie said addressed access to care. Our innovative approach includes being in the community. We are where we need to be. We're going into homes. We're going into schools. We have a huge school presence now. We're in about 12 schools in the greater New Haven area. And that's going to go away. That's going to be cut back.
I mean, like totally, we've had a bunch of shows here at WNHA, so people in schools have talked about the ways you have helped people running schools to help a kid who's having trouble at home deal with that problem so that kid can actually go to school and learn. Are you just be doing none of that with this cut? Or?
Well, we'll be doing less of it, certainly. And it wasn't too long ago, I was at an event, and I had the great privilege of sitting next to a New Haven public high school teacher. And I said, so you're in one of the schools where we are? And she said, yeah. She goes, you know what? I can teach my classroom now.
Well, there's no question what you guys do is essential. I mean, everyone agrees that we need to have social emotional support in schools. I'm trying to get a handle on this $500,000 of the Medicaid cut. Will there be, how many fewer families would be helping and where? Do you have any sense how much you've analyzed this?
We haven't, because we just got the numbers, and so I'm sorry to say I don't have that now, but I have an idea of the salaries, and I know the caseload, so I would say...
So you'd be laying off people?
I will say that my CEO, Alice Forrester, is huffing and puffing and wheezing and trying to make sure that doesn't happen, no doubt. But nothing's off the table at this point. I mean, what started as a crisis is looking to be a catastrophe.
Which will become the new normal, right? Because this week it's what's in the executive budget. Next week it's what's going to be in the 2-year budget. The next week after that is what's the new version coming out of the federal government. The week after that is if the... I want to ask you guys about this looking ahead. It is possible that the Republicans are going to give up. Even Donald Trump said, we're going to give it our best go now, and if we can't do this, we'll move on to something else. What happens if the federal government gives up on eliminating Obamacare, cutting back Medicaid? Are we going to be okay, or are there subtle ways through administrative changes or non-bill ways of legislating at the executive branch that we're still going to see Medicaid cut, Sheldon? And again, please get that mic right up to you.
Yeah. The two pieces of that, if Obamacare, if the repeal effort dies, which I would really call it a Medicaid destruction bill, because that's what it mostly does, the administration on the federal level still can wreak havoc with the exchanges by, for example, we've heard about the cost-sharing reductions, perhaps, which is whereby low-income people get help in covering the co-pays and deductibles in the so-called silver plans. Those are critical. Without it, they just can't afford it. The Trump administration has been threatening all along to stop making payments on those, which would cause the insurance companies to default. In addition...
Can we just go single payer? States are talking about creating their own single payer plans. I know we're the insurance capital, even though Aetna's moving its headquarters because the CEO wants to live in a more fun city. But is it realistic to say, because the Democratic Party, even mainstream elements, have started to embrace single-payer health care. It's kind of safer when you call it Medicare for all. Is it possible we could just do that and cut out the insurance companies?
Personally, I think that would be possible. An easier lift, perhaps, still very difficult, would be, and some people running for statewide office have been talking about this, is a public option within the exchange. So in other words, as the federal administration tries to make the insurance companies give up and make the exchange part of Obamacare collapse, again, the Medicaid part's doing just great. We could create a public option on the exchange, which we would try to get back years ago.
And with Derek Thomas saying we're going to need to find new revenue sources, can we do that without finding new revenue sources to grow government? Will we save enough money from inefficiencies in the system to be able to cover it at existing levels?
It's possible. In the early days of the rollout of Obamacare, there was something called the Basic Health Plan option, which some states have chosen. And we argued that basically the great efficiencies we have in Medicaid by not having insurance companies and not having all that high overhead, and by having a large group, that we could do the same higher up the income chain. So that would be an example of the public option that we might look for.
And Cheryl, I want to ask you also how much potential there is in private donors to make up the gap of government. Obviously, philanthropy can never make up what government can do. But in terms of fighting on civic issues against the Trump administration, the ACLU, nonprofit groups like ProPublica, and the NPR, they're actually getting more money than they ever did from private donors to fight back Planned Parenthood against government cuts. Is that true at the local level, some Clifford Beers? Do you have enough? I guess we're not considered, believe it or not, relatively a wealthy area that has a lot of donors. Are there enough people around you can go to and say, this week they're cutting us $500,000, we're going to have to lay off people, and poor kids, their lives are going to be ruined unless you help make up that gap and do that twice a year, 3 times a year, every time a crisis comes?
Well, from your lips to God's ears, that would be fantastic. I will say this about our donor base. They're loyal. We have a very loyal
But how many times can you say to them, and you're never lying when you say this, how many times can you say, we just have a new reason to believe this is a crisis and we're going to have to lay off people, people aren't getting services unless you make up this latest cut? How often can you go to the well?
You can go as often as you want. Whether or not you're successful is really what we're looking at. We have found, going back, once again, I hope I don't sound tired, but to that innovative thing, and the idea that we're trading in early intervention and prevention, we're getting a lot of traction with the idea from our donor base that it's going to cost me, donor, less long-term if I support you, Clifford Beers Clinic, now in these efforts to get to the children and families before they become costly. And so that's been very effective for us.
And yes, and you're jumping in, yeah.
Would say the same in terms of trying to convince those who believe in small government that it is cost effective for government to invest in health care, in early education and quality education, instead of the costs of people who do not master their developmental task of becoming industrious and capable workers.
Well, before we close out here on Dateline New Haven and WNHH Radio, we've been talking about the threats today to Medicaid at the state and federal levels. Sheldon Talman, you've been working in the trenches on this, 25 years, 20 years? You spent all your time on Medicaid, right?
Yeah, the last 26 years in the New Haven legal system is pretty much Medicaid.
And
yeah.
please put the mic right in front of you. So, Sheldon, this fight has taken many forms. Today we've talked about today's fight, but I know the system has changed over the years. Managed care used to be a word that sent horror through everyone trying to get their benefits on Medicare. The way companies are set up, you are fighting to have your clients who don't have a lot of money get money they were entitled, healthcare they're entitled to under earlier versions of Medicaid and managed care. How has the fight evolved over 25 years that you've been living it? Have we made progress? Has the core reason we have to keep fighting for it changed?
I don't think the core reason we have to keep fighting for it has changed. I will say that since we moved beyond the managed care model, we've had a very good working relationship with the state officials who run Medicaid, because we agree that providing it efficiently by the state with patient-centered medical homes, with intensive care management, other innovations, really is working for both the taxpayers and the folks themselves. So we do have that agreement going forward. The problem, of course, is the financial situation in Connecticut presents a real problem, and that's why we in legal services are supporting a variety of revenue options as a better way.
Well, it's a tough fight. There are a lot of reasons to feel glum these days, but sitting in this studio today, I feel more helpful because of the work that you 5 people are doing for a just society and to see that Medicaid survives. I want to thank you for joining us today on Dateline New Haven and WNHH. Thanks to our guest, legal aid Sheldon Talman, Bonnie Mueller of the Friends Center, Cheryl McNamee of Clifford Beers, one of the great institutions in New Haven, Derek Thomas, Connecticut Voices for Children, which really is the voice for the people who don't always have a voice at the Capitol, and Christine DeRossi, who got to watch her plight to support her daughter with a rare genetic order and others in similar situation be heard in the federal government. We're going to take it out with the Afro-Semitic Experience performing I Wish I Knew How It'd Feel to Be Free from the group CD, A Plea for Peace. Now, we know what it's like to be free. We just got to remember to book our flight. Book your flight with us all day and all night long here at WNHH, New Haven's home for community radio.